Aye, we give you the facts. It's not what you think. Popeye Newsling, Young King, 1 yard, bless.
Good morning, Popeye. Grandma watch Popeyes every morning and every night.
What am I think? What am I think? You're listening to Popeye News Links. This is the Admiral Tibet who I represent, and remember, the time is so serious, cantankerous and dangerous. This is Popeye News Links.
The first verse of the national anthem, it goes like this. Sing with me. Yeah, man, stand up. Anywhere you are right now, get up and stand up. Stand at attention. You can stand at ease. Eternal Father, bless our land. Guard us with thy mighty hand. Keep us free from evil powers. Be our light through countless hours. To our leaders, great defender, grant true wisdom from above. Justice, truth be ours forever. Jamaica, land we love. Jamaica, 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 land we love. So, here's some sound, you know, when I was singing the chorus. Boom. Good evening, everyone. Good evening. Good evening. Sadika, it's your birthday? Sadika Allen, happy birthday to you. How wanna do? How wanna do? So without further ado, we are gonna be joining Dr. Elliott because he have a time is limited this evening. You have to be out by about 6:40, the next 39 minutes. Doc, how you do, sir? I'm getting a feedback. Something is bad. Getting a feedback. I'm getting a feedback. I don't know why. Oh, Doc, you have another phone on. Turn off the other phone. I think it's the other phone. I'm seeing that another. All right, I tell you what. Let me just take off this. Yeah. All right, come back in now, Doc. Oh, no, do Sadika. Happy birthday to you. Bless upon yourself. You know, this morning we wanted to carry something and then we had some technical issues. So we had to abort it. But, yeah, man, happy birthday, Sadika. And Dexton, yesterday was your birthday, sir. You're still in Jamaica enjoying yourself. Happy belated birthday, Dexter. Are we waiting on Doctor rejoin? Nevardo, how are you doing? Karen, how are you? Today your birthday too? Happy birthday, Karen. Happy birthday to you. All right, let me see if Doc is on now. Teresa, what you say?
Hello.
All right, Doc, how you do? You hearing me now?
Yes, man. No more feedback.
All right. You're much better now. Good evening, sir. I know your time is limited. So, how are you doing this evening?
I am doing well. How are you doing? And hello, viewers and subscribers. Good afternoon.
So we have online. Dr. Elliott from. Well, go ahead, Doc. Go ahead.
Yes, sir. So, as you know, Dr. Elliott, Urgent Care 360 plus Family Medicine. So time is limited today, but we want to continue the program. As I said, we want to do this at least every month. If we can squeeze in on, an extra one of the programs in a month, we can certainly do so. But this month we're due. We didn't do it last week, so I wanted to get started today. So we'll take the questions at the end, or should I say after we go through a couple of topics, just to get that going. So the topic we're going to do today, as I mentioned to you, was cholesterol, or should I say high cholesterol, and we'll talk about pregnancy in light of the fact that we just had Valentine's. So without further ado, we'll jump right in.
Yes, sir.
Cholesterol, or high cholesterol in essence, is a risk factor for a lot of different things. But first, let us talk about cholesterol. Cholesterol is a waxy substance that is found throughout the body, within the bloodstream. In moderate amounts, we don't need a lot, but we do need it to basically produce a lot of the cells, repair the cells, produce hormones, and also it helps with vitamin production. So it is essential. But as we know, things in excess are not good for us. So in terms of the cholesterol, whether it be high or low, because you know they talk about the good cholesterol and the bad cholesterol. In essence, the LDL, right, which is the low density lipoprotein, is usually the bad cholesterol, and then the good one is the high density lipoproteins. But both of them in high quantities is definitely not good for us. But we prefer the low one to be lower than the high one. But you know, in general, we don't want any of them to be high. So having high cholesterol puts you at risk for getting, as we spoke about, because we already did stroke, it puts you at risk of getting a stroke, puts you at risk of getting heart attack and heart disease, right? Different things going on in the heart, including a heart attack. Puts you at risk of getting something called peripheral artery disease. And basically what that means that the arteries get clogged up. And then of course, you know, it puts you at risk of getting high blood pressure as well. So from a number perspective, it is something that is essential that you get checked. It's part of the executive profile that's there.
Yes.
And in terms of numbers, depending on which lab you use, they'll tell you what the ranges are. But the general numbers right across the board, we want it to be below 5.2 in general, right? And then once you see something from like 5.2 to 6.1, it is high but not extreme. So at that point, we don't have to put you on medication. But generally, 6.2 and above, we start thinking you need to be on medication because now it's very high, and that puts you at a very high risk. As per usual, a lot of these things go with family. Your family history has a lot to do with it. Diet has a lot to do with it, which I'll touch on a little bit more. Exercise, of course, is not, you know, making sure you have a good lifestyle from that perspective. So going back to the diet part of things now, steam, grilled, baked is usually where we want to go. Things that push up your cholesterol in general, because it's produced by the liver, and it's iron, you can't get it from foods. So things that are fried, I know we like our fried this and fried that. Those are things that usually pushes up your cholesterol. So keeping those down. Coconut oil is one of the things that actually has these oils that are saturated, and same thing with palm oil. So not good for us to use. Again, steam, grilled, baked, best way to go. In terms of eggs, if you do eggs, or if you have eggs, boil it and take out the yolk, especially if your cholesterol is high. And generally, shell food in general. So things to eat which will help. Now, studies have shown oat or oatmeal helps. I've seen some studies as well, or some articles have avocado in there as well. So those are good. And nuts in general, almond, peanuts, those usually help. Soluble fibers as well. So those will help you in general. But the best thing to do is go see your doctor, get yourself checked from that perspective, especially if you have a family history of any heart attack or any stroke. And also, as I've always said, try and get your blood work executive done so you know where you are and what you need to do, especially if you're not eating very, very healthy. And I know a lot of times because of the workload and stuff, people tend not to. They eat a lot of fried foods or fast food, which is not good for us. So definitely you want to be checked. If you are at a high range, then your doctor may put you on something to bring it down. But in general, lifestyle modification changes usually helps quite a bit, because again, it puts you at risk of getting those diseases that are very, very hard to treat. And as we know, the number one cause of death in Jamaica is stroke, right? So that covers cholesterol or high cholesterol in general. And I wanted to touch on it because it's one of the risk factors to the other topics that we discussed previously. So now, the next topic we wanted to talk about now is, in light of the fact that Valentine's just passed, is pregnancy. And pregnancy, pregnancy is a broad topic. So it's really just to talk about, in general, a bird's eye view of pregnancy. So pregnancy starts when the sperm from the male basically finds the egg from the female and fertilizes it. Once that starts, pregnancy starts right there. Now, it usually happens, well, it happens in the fallopian tube, that's fertilization, and then it travels down to the uterus to be implanted, and then the baby starts growing. Now, things to look for. So, from a normal pregnancy, that happens, goes into the uterus. what you'll most likely, but it's not always, but most likely, if you miss your period, something to start thinking about, women. Now, generally speaking, when you miss your period a day or two, if you do a urine dipstick, you may not see that you're pregnant because it needs the hormone needs to be at a certain level in the blood for it to spill over into the urine for us to see it from a test perspective. But if you do a blood test, you can certainly see it.
Yes.
Generally, as a rule of thumb, a week of missed period, but really the 2 weeks after missed period is where you usually see. 2 weeks after, as per the textbooks and stuff, is generally when you should start seeing the actual hormone that is detected in the urine. Now, again, not a rule of thumb. I've seen it different ways and so forth. And as we know, medicine isn't really one of those that it's this or this. So there are variations. But generally, 2 weeks after a missed period is generally when you can start seeing it from the urine perspective. Now,
Yes.
if you are indeed pregnant, find your doctor right away because there's a few things. If you were trying to get pregnant, great. You should have been already on folic acid. If you find out by chance, then you definitely want to see the doctor. You want to go on some folic acid. And if it is depending on the dating, the doctor can calculate the dating. Then what can happen there is that you will be written up to do an ultrasound, and you'll also be written up to do some blood work to take a look at your blood count and also make sure that you are immunized against certain things, and just to see where things are. So we have a baseline of what's happening with you from a perspective that is, getting ready to give birth.
Yes.
So very, very important. And of course, at that time, you'll see, the doctor to basically outline how often you see, once a month up until certain weeks, and then you have to check your glucose and make sure your blood pressure is under control, make sure there are no urinary tract infections. So things to look for, apart from the missed period, right? You might have some nausea and or vomiting. Usually they call it morning sickness, but it can happen at any time, right? You may have breast tenderness or breast fullness. That can also happen, right? You might start having mood swings as well. So those are
Yes.
little things to start looking for. Breast, as I said, and just generally just feeling like you're craving something else or not feeling yourself. Something to start saying, let me go and get myself checked out from that perspective, right?
Yes.
So that is a normal pregnancy. And again, see your doctor so they can start, putting together, getting you ready to basically be a mom. Now, the other part of the pregnancy, that's a normal. We also have something called ectopic pregnancy, where the fertilized egg is implanted, which means that it didn't get to the uterus, it stopped somewhere outside of the uterus, it's somewhere else. And now that is an ectopic pregnancy, which is not going to develop into a baby because it just won't happen because of how the anatomy and how we were designed. Now, that usually comes with a few other things. You still have the missed period, but you may have abdominal pain and you may have vaginal bleeding, whether it be blood or some brown substances. At that time, absolutely find your doctor. You can still have the breast because it's still a pregnancy. It's just that now it's now not in the place it needs to be. And this one needs surgery. Not all the time surgical intervention, but sometimes it does depending on what is found out. So that's a medical urgent case, and in some cases, medical emergency. So you need to
Yes.
see a doctor right away if that start happening. An ultrasound is done, pregnancy test is done, and then the decision is made whether or not you're managed with medication or
Yes.
a surgery is done. Very, very, very important. So
Yes.
that is it in a nutshell from the perspective of pregnancy. There's lots more to it, but I just wanted to enlighten us in light of the fact that Valentine's just passed and something that we're gonna more than likely start seeing as well. Because of course the babies that are created at that time usually is a November baby. So my
Yes.
goodness.
Yes.
So
Yes.
those are the two topics. Those are the two topics, sir, for the viewers and Mr. Popeye. As you know, I
Yes.
usually bring at least one or well, two, at least two topics for
Yes.
us to talk.
How,
So
how,
if
how
anyone
about
has,
how about STD and Valentine's?
yeah, well, you and I spoke about that, and I said I was going to touch on it, so
Yes.
we can touch on it, absolutely.
Yes.
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 So unprotected sex, of course, can lead to the pregnancy, and it can also lead to the sexual transmitted infection. So we'll touch on it briefly.
Yes.
In general, from the man's perspective, anywhere from having unprotected sex from day 2 to 30, if you
Mhm.
start having pus from the penis, which means that you start seeing some yellow discharge, or you start having extra burning. Could be a urinary tract infection, or most likely it's gonna be, in this case, if you have the pus, it's gonna be a sexual transmitted infection. Now,
Mm-hmm.
sexual transmitted infections from a bacteria perspective, there are lots of them, but the three main ones would be the chlamydia, the gonorrhea, and the trichomonas, and those are the ones. And in Jamaica, the most prevalent is the gonorrhea. Here, somewhere else
Mm-hmm.
like the UK, how it's more chlamydia. So those
Yes.
are the three, but there are others out there, right?
Yes.
In terms of the others now, we also have to think about HIV and syphilis, right?
Yes.
And
Yes.
those are also, so from a syphilis perspective, on the genitals, you'll get something that looks like an ulcer, like on the shaft of the penis, or in the vagina, or around the vagina. An
Mm-hmm.
ulcer which is painless. So that's something to definitely look into. And in
Mm-hmm.
terms of HIV, you can be checked from an HIV perspective. Do remember that if you're infected today, it doesn't necessarily show up until 45 days, or even 60 to 90 days later. So it depends. But usually, if you do a blood test from a instrument perspective, you can pick it up sooner. But usually 3 months is when you check for
Mm-hmm.
HIV, and of course,
HIV.
if you start seeing symptoms of syphilis. So those
Yes.
are your sexual transmitted infections. So two, which is with the syphilis, HIV, or blood test, and then now for the bacteria now is either a swab or first morning urine. So how you check for those would be you do a swab. You have some quick kits that you can do as well, or you can actually send it off to a lab. If it's to a lab, it's a swab, and that swab can be done. It usually takes about 2 weeks. Or the
Yes.
first morning urine. So you'll get a sterile cup and then you urinate. And when you wake up, you go urinate. So those are
Yes.
the symptoms for a man. Now,
Yes.
women
Mm-hmm.
can be from those sexual transmitted infections, those three that I mentioned or others. Women can be asymptomatic, or they can start showing the same, I would say, discharge from the vagina, and it can also be something where you start seeing a yeast infection in collaboration, or should I say, as a co-infection with those. So again, something to look into. So definitely
Mm-hmm.
something to check out, something that we should all be aware of as well. So yes, absolutely.
Okay. Okay. Well, that covers a lot, sir. That covers a lot in what, 15 minutes, less than 15 minutes.
Yes.
Viewers and subscribers, any questions? You're getting some free advice here. Any questions? I'm just checking. Let me see if any question was posted before.
No problem.
Mhm. Why? No question from anybody? From any topic? Medical questions? Why? See me? I've been learning a whole heap. Let's see. Sharon Savage, blessings, blessings. Any medical questions?
All right, while you're trying to put together some questions, we just can talk about treatment for these going
Yes,
forward.
yes,
So,
yes.
so while some questions are coming up.
Hmm.
Um, so the usual way is, so when there's pus or suspected sexual transmitted infection from those three, the chlamydia, the gonorrhea, the trichomonas, you're
Hmm.
usually, what happens there, you get an injection, which is ceftriaxone, right? And the guidelines now is 500 milligrams
Hmm.
IM, right? You get
Hmm.
an injection. It is an
Yes,
injection that is a bit on the painful side, right?
yes.
It is something to warn the patients about, right? But you do get that right off the bat. We call it stat dose, and then you'd be sent to the pharmacy to get two other medication to cover the other two. So the roquefine, which is ceftriaxone, right?
Hmm.
You're given that. That covers the gonorrhea, and then now to cover your chlamydia and your trichomonas, you want to get something like a doxycycline, which is the now preferred way, and then to
Hmm.
cover the trichomonas, you'd use flagyl. So you'd go to the pharmacy, get two antibiotics that you take by mouth twice a day for 1 week. Don't take both of them at the same time; they're a little harsh on the stomach. So you take one, separate it by about half an hour, and then take the next one, and that
Okay.
usually clears it up, right? Of
Hmm.
course, we usually, once we have the symptoms, we treat and then we test at the same time. Because if you wait till the test comes back, that's 2 weeks later. That's a little discomforting for both parties, right?
Yes,
Now,
yes.
with syphilis, depending, it is penicillin G, and it's 3 doses, and so that's given as well. And as we know, for HIV, that one is difficult. You'd have to go on antiretrovirals. There's no cure, but you can actually be on you can be set up where you can actually function on a normal, as a normal person from a perspective of your immune system that is as best as normal as we can get it if you stay on your antiretrovirals, right? So
Okay.
those are your treatment options there, but definitely something to look into.
Mm-hmm.
Definitely something that we see quite often after events. Generally, we see it all the time, but mainly after these events that happen.
Yes, 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 yes. All right. Somebody's asking if you are having a reoccurrence of urine infection. What could have caused that? Urine
It depends.
infection.
Right.
Yeah.
So a urinary tract infection could be a number of things. One of the things we check at that time is the piping system. So we would do an ultrasound to see if there are any valves within the urinary tract system that's kind of keeping the urine from actually coming all the way out. Because when you have something called stasis of urine, when it stays there, the bacteria multiplies and then you can have recurring urinary tract infection. So that's
Mm-hmm.
one thing that can be there. The other thing too, it
Mm-hmm.
depends if your work or your lifestyle has you where you're holding up your urine a lot. So you will get a recurring urinary tract infection because you're not flushing out the system fast enough. So say for example you're traveling to Kingston 2-3 times a week and you don't stop. That can
Mm-hmm.
also put you at risk of getting a urinary tract infection. Again, having keeping your immune system high as well, probiotics, those normally help to basically keep your urinary tract infection at a minimum. Now, do remember as well, not remember, well, I did say it before in one of the other episodes, but I'll say it
Yes.
again.
Yes.
Having sex do put you at risk of getting a urinary tract infection, but it is not per se that you have a urinary tract because of sex, right? But it puts you at
Oh.
risk of getting it, right?
Okay.
But it's one of the things that happen. So if you have recurrent urinary tract infection, it needs investigation. Let us put it that way. It needs to be checked from a perspective of, is there something more underlying in it? Is there another bacteria that is there that made its home within your urinary tract and we just haven't
Mm-hmm.
found it? So in
Yeah.
that way, if you see a patient with, so in for us, what we do is first time we check on the patient because we call our patients and follow up. Urinary tract infection is gone, then we're good. If it happens a second or a third time, then we send out to do a urinary culture to find
Mm-hmm.
out what bacteria it is, and then we treat accordingly based on the bacteria. If it happens again, then we do an ultrasound. We do the
Mm-hmm.
full workup at that time. Ultrasound, sexual transmitted infection, we do all 9 of them, and we just basically go over the full system like that. We go take out our history, make sure the immune system is functioning well, those sort of things, right? So
Okay.
definitely, if it is something that's recurring, it needs investigation. And again, it could be as simple as just lifestyle. You
Yes.
you get one urinary tract infection and then you not flushing out the system. Um, do remember as well and we talked about it when we talked about prostate, enlarged prostate, prostate cancer versus benign prostatic
Mm-hmm.
hyperplasia, the stasis of the urine, that's where the ultrasound comes in. If the prostate is getting enlarged and urine is being backed up, then absolutely you'll get a recurrent urinary tract infection as well, right?
Yes. Yes. Yes.
It does
Is
need,
go ahead. Go ahead. Mm-hmm.
I was going to say, it does need investigation. So find your doctor, find us.
Mm-hmm.
It does need investigation. See the clinic, whatever it takes. Your health comes first. So whichever avenue you want to take, just get it looked at from that perspective.
Yes.
Don't take it light.
Yes, sir. Is pinch nerves something that can be cured?
It depends. It
Mm-hmm.
depends on the nature of the pinched nerves. It depends on where it is. It depends on if you can do surgical interventions. Again, it all depends on the nature of the pinched nerve. Generally, you want to start with physiotherapy and exercise, right? MRI is usually done. Physiotherapy is done, and then depending on what's there, there could be surgical interventions. So you can either be, depending on where it is, neurosurgeon or orthopedic surgeon goes and look at the spine. So you have some orthopedic surgeons that actually focus on the spine, so they can
Mm-hmm.
look at that if it's a pinched nerve within the spine. But yes, it depends on the nature of the pinched nerve. It depends on how far along it is. It depends on the degree.
Mm-hmm.
But you can't say yes or no depending on it. But it depending, it's possible. But
Yes.
it's something that should be looked on as well.
Okay. What if a person is pregnant and that person has HIV? Does it have to harm the baby?
No, no, not at all.
Mm-hmm.
It is. We have had successful births with mothers who have been HIV positive, but a lot
Mhm.
of precautions need to be taken. That is now considered a high risk pregnancy, very closely monitored. But yes, it can still be done.
Okay. What if I'm on cholesterol pills and each time I do a blood test, the result is okay? It spiked only once. Is this something that I am going to live on, meaning the pill?
Not necessarily. It's for you and your doctor to decide. So what can happen is depending on the doctor that you're seeing and how you both want to work with it. What you can do is, of course, your diet would have to change significantly. So hopefully you did that. Come off the tablets and recheck yourself in 3 months. See if your numbers are remaining consistent or are they going up. Now, remember, I just mentioned quite a few foods that can help to lower cholesterol, and studies have shown that. So,
Yes.
again, you can use, if you lower it using medication, then lifestyle change on top of that may help. Can't say
Yes.
yes or no for sure because sometimes you have some things that are just genetic, where you're genetically in line for your cholesterol to be high. So hopefully you're not in that case, and hopefully you bring it down and it was a lifestyle change that you can use. And once you use that, and remember, weight loss helps as well. Going to the gym helps as well. So if you can talk with your doctors or something that you guys can take a look on, absolutely you can. We can always try that because the key to us is not to be, even though we're doctors, we prefer you not to be on medication. In my training, the first thing you do when a patient is ill in general is lifestyle modifications and
Mhm.
diet, meaning change what you eat, change how you go about, change your sleep patterns, exercise, those things. So again, that is something that can be looked at.
Okay.
However, you do need to work with your doctor, work with the blood test, see if it's going up, see if it's going back down, and see if that works for you. But lifestyle definitely something that can work. And going to the gym says a lot in terms of lifestyle, having a very good quality of life. So definitely something to be looked at. Absolutely.
All right. Somebody saying I have a lot of pain in my foot because I stand a lot at work. I lift a lot of weight. But the person saying they don't know what is causing the pain in the foot.
All right. Is it all right? I'm gonna say this in general, and maybe the person can add a little bit. The
Mm.
foot being in the bottom of the foot being in around the ankle, foot being in, because sometimes when we say foot in Jamaica, we mean the entire leg.
Yes.
So let's talk about it a little bit.
Mm.
Again, this is called ergonomics. So if you stand a lot in not in Jamaica as much, but in the other countries, you would have something to stand on, which is like a platform that helps with
Mm.
your, so ergonomics meaning your back. So when you stand
Mhm.
on it, it's a cushion. So it
Mhm.
looks like it has little holes in it and it's a rubber. So if you stand a lot, that's something that could be in your workplace that you can stand on. The
Mhm.
next thing that is big for standing is making sure that your shoes isn't flat and hard. So it has a very nice soft insole. Now,
Yes.
a lot of the shoes out there, like I say Under Armour because I like Under Armour, but Nike does the same, Adidas does the same. They put a lot of research into making sure that these running shoes cushion very well. So that is
Yes.
something to invest in as well. Don't invest in something that's not, having a very good amount of cushion. Invest in a nice running shoes that cushions you with respect to you being on your feet a lot. Because we doctors are on our feet a lot. That's why we wear Crocs. Crocs is also a very good cushioning because it's nice and soft. So it keeps
Mhm.
you from being flat and being on a hard surface. So ergonomic setup from that perspective, especially if you stand a lot. I mean, doctors stand a lot, cashiers stand a lot, just customer service stand a lot and walks a lot. So that certainly helps from the perspective of having pain to the foot as well.
Yes.
Now, there are some conditions though that can happen, and
Yes.
it may be that you start developing something called heel spur, right? You could have, or if you're standing a lot, you're on your feet a lot, then you start, having, um, I wouldn't say arthritis to develop, but more of pain to those areas, and you could start developing arthritis. So again, it's just to look at it from that perspective as well. But
Mhm.
that is a broad answer. But investigation needs to happen depending on where in the foot. You might need an X-ray, might need an MRI. So it is something to be investigated as well. But it sounds to me like if you're standing on your feet a lot, it sounds to me like an ergonomic setup. And it's
Mhm.
something to look at. If you're standing on your feet, lifting up stuff, maybe you need to take a break a little more often and invest in, like I said, one of those very comfy running shoes. even do some research online to see which one is the best running shoes within. I just named out a couple because those were the ones that I looked on, and they seem to have done very well. As you can see,
Yes.
when even basketball players, you notice those are the kind of shoes that they wear, right? And then
Yes.
from the
Yes.
perspective of that I know from the other countries, you do have, when people stand a lot, they have these rubber mats which are for ergonomics, where you stand on and they're nice and soft and they have little holes in them so that you're not putting any pressure and your back is aligned and all that. So it's again an ergonomic setup, and that
All
helps a
right.
lot from the perspective of you being on your feet a lot. It helps to
Mhm.
stabilize the back, stabilize the muscles, take off a lot of pressure off your different muscles as well.
Okay. What about a 13-year-old seeing her period for an entire month? Is it serious?
It needs investigation. Now a couple of things happen there. Seeing the period for a month means that your blood count is going to go. So yes, it can start to get serious, because now you're going to have issues where blood count is low, not going to function well in school, feeling tired, sleepy. So that's something that we need to look on. It
Mm-hmm.
also needs investigation from an ultrasound perspective, just to see if there's a hormonal imbalance, is there something going on from a cyst perspective, and there are different things that can happen at that age group as well. So I would say absolutely get it investigated. Don't sit on that one. Definitely get that one looked into, because there are different things that could happen, and we doctors can give medication to stop the bleed, and depending on what's there, we can hopefully fix what is there depending on what is there as well. But absolutely need investigation. See your doctor, come and see us, but look into that right away, please, and
Yes.
fix the fact of, if the bleeding has been going on for a month, then a lot of blood has been lost. So you want to replenish that. So more than likely, iron tablets are indicated, meaning that you should start going on. She should start going on iron tablets as well.
Yes.
But
Yes.
something to
All
do
right.
with it, absolutely, right
Yeah.
away.
A female says she's feeling a burning in her upper back, and I have been to the doctor times upon times and still don't get any results. So the burning is still there.
All right. So burning upper back. It all depends. I don't know what investigations were done. Hopefully,
Mm-hmm.
investigations were done with respect to, starting with simple X-ray, then moving into MRI, moving into blood work as well, taking
Mm-hmm.
a full history, understanding the nature of it. Did it just start? Did it happen after an accident? Was there a muscle strain? Was there something being lifted?
Mm-hmm.
And again, do remember that it depends. I'm not sure what led up to this, but
Yes.
a lot of times as well, just finding out what the answer is can help you to understand what your prognosis would be, meaning what would be your likely outcome of from this. If you have the
Yes.
burning there, is it burning in the morning? Is it in the evening? Is it after you lift something up? Burning in general, we're starting to think nerve as well, right? Um,
Mm-hmm.
so it's something, could be nerve, in basically from what I'm hearing, because it's the back, because we know the spinal column is there. It sounds to me like there's a nerve issue going on. Less likely a circulation, but also you have to look into that. Once you hear burning, you have to start thinking nerve and or
Mm-hmm.
circulation as well. Those are things that we start looking into. So
Okay.
those are things. Again, there are other things out there that we have to look on as well. So that's why I'm saying, see the doctor, take the history, take a look at it. And I'm not sure how deep those doctors went, or maybe they did go deep, and we need to. A lot of times, in medicine, we'll look around, we'll do all the investigations, and we didn't find what we're looking for. And then we
Mm-hmm.
have to restart. We go back to the drawing board, we rub off the drawing board, and we
Mm-hmm.
restart the program, because sometimes something didn't show up. Not that it was missed, but it wasn't. It didn't reach the level that you can see it at the time. It was just starting out. So sometimes redoing it or doing it over, doing some of these things over, you can say, oh, that was there, but it was too small to see, or it was
Yes.
not high enough for to us to detect it, right? So sometimes you
Yes.
need to just revisit those. So if it not sure where this person is, if they are around, they can come see us. We can go through the history.
Mm-hmm.
That one I would say, book an appointment, because that one is
Mm-hmm.
not an urgent case. Book an appointment so we can sit down for half an hour, even an hour, and work through everything. That's something that we'll do
Okay.
from urgent care perspective, urgent care 360 perspective. But something to look into. And the
Mm-hmm.
fact that you haven't gotten any results means that we need to look at it again and see if we can find it. And then from what we find, then we can start saying, what are the likely treatment plans or what are the likely outcomes, and hopefully we can come to something to find it, because generally, these burning sensations, they're hard to treat, but hopefully we can find a way around it and fix it.
Okay. Are there any symptoms for high cholesterol?
Well, yes, there are. So one of them is, if you look around the eye, around the pupil, there's something there. So if the lipid, the deposits can go there, and it's called coronal arcus. So that's one thing. Sometimes you get little lipid deposits under the eye here, and that you can look on it. It's called xanthal asthma. That. So those are some of the things. In general, though, in terms of cholesterol, when you start having these symptoms, I've read something as well where it says you can have numbness as well, so that's something that's there. But a lot of these symptoms that you're gonna start seeing from the cholesterol usually points to when you start having the chest pain. So now the cholesterol is high enough to start giving you issues with your blood flow to the heart, and a lot of times that's when it's too high for us to
Yes.
basically. I mean, it can be reversed, and I'll talk about that too. But in terms of the symptoms, to say, okay, yeah, man, my cholesterol is going up, a lot of times is when it's gone a lot further. So you won't see early symptoms of it. But there are some subtle symptoms. As I said, chest pain is one of them. You can also have where you have slurred speech a little bit. So you start having some of those, I would say, stroke-like symptoms. You can
Yes.
also have something walking imbalance can also be something that's there as well. And I also mentioned that you can actually have some amount of numbness, but again, nothing hard and fast to see, because in cholesterol, it's not as easy to say, okay, you have these symptoms and
Yes. Yes.
it's not equal to. It's not as simple as that, and that's why the blood test works a lot better. And that's why I didn't mention it, because it gets a little more complicated rather
Yes.
than, so that's why I mentioned for us to go do the blood test, as opposed to you looking and say, oh, well, I don't have one of this, I don't have that, so I don't have high
Yes.
cholesterol. Yeah,
Yes.
we don't
Yes.
want to do that. That's why I actually didn't mention those, but glad you asked, so I answered those for you. Because again, clinically, you're looking for those under the eye, the deposits here, the deposits around the eye, but as a untrained eye, you probably won't see it. So again, I didn't mention it. A doctor can see that. As soon as I look at a patient, I can tell. But again,
Okay.
for someone who's not as trained, you might miss it. And I don't want you to say, oh, well, I didn't have that, so I don't have it. Because by then, when you actually start having the symptoms, now you start having the chest pain, now you start having heart disease, right? Called ischemic heart disease. Now the arteries are blocked up. Now you can't do exercise as much as you can, or you end up with a heart attack because now you have chest pain and now you realize that your arteries were blocked, or you had a stroke. So that's why I didn't mention it. But glad you asked. Those are your symptoms. But the best thing to do is to get the blood
Blood.
test done and
Blood
check
test.
up.
Yes.
Yes, man, and get your number. Know where you are.
Yes. Yes. All right. Somebody's asking. We're gonna X out HIV because we covered that already. But what if a woman is pregnant and have any of these infections? I think she's talking about the gonorrhea, syphilis, and the chlamydia. How dangerous is it for the unborn child?
All right, so it is dangerous for the unborn child. So a lot of times, again, and this one will now go over to high risk pregnancy, how the baby is delivered, and it's about the delivery, right?
Yes.
Now,
Yes.
there are some medications that you can use while the pregnant, and some that
Pregnant.
you can't. That is right. So it depends on which infection. So if it is an infection that can be treated, then yes, it's treated. If it's one that can be treated, then we have to look on it and say, okay, we now have to manage this as a high risk pregnancy, and these are the things we're going to have to do. We'll have to do a C-section, can't go to vaginal canal, those things. So yes, it can, if the infection is there and the baby passes through the birth canal, then yes, that can be a very serious thing for the baby when the baby comes through the birth canal. But before that, generally, not exactly. You can have, what it does put the baby at risk for is premature birth. So that is something. So when we have a premature birth, we normally check to find out if there was a sexual transmitted infection that was treated, was there something else that was treated. But at the time of birth, if there is one of those, and it is something that's checked, that's one of the, in pregnancy, those are things that are checked. The sexual transmitted infection panel is done. All those are done, because if the baby passes through the birth canal and one of those are there, then we will certainly have a serious issue with the baby.
Yes.
But again, like I said, depending on which one is there, that's why we can check we may or may not be able to treat, but high risk pregnancy, absolutely for sure.
We had said 6:40, so we have 1 minute leave, doc. So should a pregnant woman consume raw eggs?
It well, let's back up. I mean, generally speaking, what we want to do is have a healthy lifestyle. So raw eggs is not something that we would say you should have. And I'm not sure why we would want to go with the raw eggs rather than cooking it, right? In
Yes,
general, though, when you're pregnant, you want to keep a lifestyle that is pretty healthy. Now, it's best to cook things rather than having it raw because you don't want, same thing with vegetables. You want to make sure you wash your vegetables because you don't want some of the chemicals there or any bacteria to go inside and then you have issues. So, my suggestion is cook the eggs rather than having it raw because generally raw eggs is not a norm for us. Generally you want to cook because when you cook you basically kill the bacteria, kill what is there, and you denature the protein, so the proteins now can't cause any issues. Because eggs in general, just from a chemistry, because my first degree is chemistry, eggs are generally used, it's high in protein. So when you want to basically grow something like a virus and stuff, it usually, like when you're making vaccines, they usually use eggs or eggs
Oh,
protein. So what am I saying? I am saying that eggs can carry stuff that you really don't want in terms of if you're pregnant. So you want to just keep yourself very, very healthy. So boil the egg, and I'm saying boil because I want you to stay healthy rather than frying the egg. But you can also fry the egg. Just denature it, have a very healthy lifestyle, cook the egg, make sure things get to a certain temperature. Because when you're pregnant, you want to stay healthy. You don't want anything to go off scale where you have no gastroenteritis or some other infections going on, vomiting. You just don't want to have that. So my suggestion is cook the eggs, cook whatever. If you're doing vegetables, wash it very, very, very well, and make sure things are kept clean.
yes, sir. Well, I think that's it. But you have anything else you want to say before we?
No, I mean we covered a lot of the stuff I wanted to say. I mean, just the general, you know where we are. We are uptown,
Yes.
in South. So behind Juicy Beef, we are. When you come into that plaza, it's a Beckford Shopping Center. We're upstairs, as I've always mentioned. We are 24. However, we do urgent care medicine exclusively at nights, but during the day, regular hours from 8 to 5, we see everybody. But outside of that is urgent care medicine. So we only see urgent cases at that time.
Yes. All right.
Number we are the number is on your
Yes.
screen, sir, and
Numbers
I
on the
know we
screen. Yes.
yes, man. The number is on the screen. You can Google us. We're right there, and we're happy to always to be of service to you to basically help us to be a healthier nation.
All right.
Okay, so
Okay, so yeah, man. Thanks a lot. So next month.
next month again, we'll figure out the time. Well, next month
Uh,
again, and
all
thanks
right,
again
sir.
for
All
having
right.
us.
All right, Doc.
Okay,
Respect, sir. Respect.
okay.
Respect. So my viewers and my subscribers, that was it for Dr. Elliott. And I'm not gonna spend another minute because I'm gonna be dropping the news in 5 minutes. We didn't carry any news yesterday, took the day off. So we are gonna be dropping. Let me go down and sit down. Okay. Where does this doctor practice? And in Savannah Lamar, it's uptown and Beckford Plaza. Right behind where the Juicy Party is. You're driving on the plaza, then you take the left turn upstairs, that upstairs building. That's right where he is in Savannah Lamar, right? Yeah, man. So, what you say, that you learn. Let me tell you something. It's very informative, and since I've started this series, remember me tell you, I've learned so much, Because sometimes we did it and we might have go on, and doing your blood work every year is very, very important. You might have look on the money and say, boy, it's expensive. But then you don't do it, and then you go find yourself with some disease where going to cost you a whole heap more. And guess what happen? You go find the money to deal with it. So if you can go out and go do your blood, if you can go out and go do your blood work once a year, it is very, very, very important. Very important. So try and sort it out. Angela Campbell, big up yourself. Empress, enough respect. And we're dropping the news shortly, and tomorrow. Many of you might have heard the interview I dropped with the young lady this morning. It continues tomorrow because I have spoken to that female who you heard threatening her. I've spoken to that female, and I have spoken to the mother of one of the guys who was arrested. And you're going to hear me talk about it in the upcoming video. There is a video that is available. I don't know how much of you know. We're listening to the female when she said the guy started to video her. Yeah, I don't know how much of you were listening, but she said the guy started to video her. Well, that video has been making the rounds because it was sent to me, and I see forwarded many times. That video says a lot, and that video say a lot about credibility, because she's saying that she was forced to do something, right? Not gonna say much, but that video will tell you, or is telling you, that she was forced or she was not forced. I will say that for now. But when you say it's 3 months, Monica, I'm not sure if it's well, it depends on where you are and what is happening. I'm not sure about the every 3 months. The next time I have Doc on, I'm gonna ask him. I think blood work do every 6 months. That's 2 times for the year. Angela, we said 2 times for the year. I'm sorry I didn't. Well, the next time the doc is on, I'm gonna have him answer that, or I might ask him and then come back and inform you. But yeah, that I wasn't thinking about that. 'Cause you're saying every 3 months, and she's saying every 6 months. So, my viewers and subscribers, the news is coming up shortly. Anytime we come off the live, we are gonna be dropping the news in 5 minutes time. So, if we come off now, look for the news. 6:50. Beverly, you're late, man. Beverly, you're just a giant. What is a pinch nerve? You're late. Oh, I tell you what, Beverly. Beverly, I watch where we just start. I when that just answer question. Beverly, not hearing what me I say, you know. That's the thing. A lot of people on that side. When they're trying to live, you know. But you go straight down and see catch what is happening. Because sometimes some people join the live and them start watching it from the start. Letitia, we say 2 times per year. All right. Fair enough. Yeah, man, 2 times per year, because like Doc was saying, certain things you can find out 45 days. Yeah, 2 times per year sound like it. But I'll get what he recommends, you know? Because, you know, different people might recommend different things. No glamorous, she didn't say that. Glamorous Cherry, she didn't say that. Glamorous Cherry, go back and listen again. She did not say that. Glamorous Cherry, she didn't say that. Go back and listen again, yeah? Go back and listen again. Margie, thank you, thank you. She didn't say that because she said the guy was pushing up on her and saying, I forget her broke and whatever. And I push up him penis in her face and all these things. She didn't say that, Glamorous Cherry. Go back and listen again. The part about video. Go back and listen again. Yeah, Margie, thank you, man. Thank you. Yeah, I love you, Lord. Yeah, right behind Juicy Patty upstairs. And that plaza. Some insurance only once per year. Okay. Letitia. Some insurance only recommend that you do it. Are they only pay for once per year? I guess if you want to do it, otherwise you have to go do it. Okay. Yeah, Glamorous Cherry. Go back and listen. Go back and listen to that video part there. When I heard it, you know, something kind of come across me because I was wondering why she mentioned it without, you understand? So I was wondering, and then I realized why she mentioned it. Because she realized that there's a video available. And how anyway, we'll talk some more about that. But based on the video I see, she didn't realize that she was being recorded. Right, Glamorous Cherry? I can tell you that. The video I see, she did not realize that she was being recorded. The guy hid the video. Hid whatever he was using. So she didn't realize that she was being recorded. So that is why I answered. That way, Glamorous Cherry. You understand? But you see, there's normally all kind of sides to a story. And you're not going to hear me a quarrel with nobody who me I interview. I give persons a chance to say what them want to say. I might ask some questions and insist that my questions answer. But if you notice some of the time, when the answer not forthcoming, I say, okay, and what's next? You understand? That's how I do my thing. Because when I interview somebody, I let them give the answer, ask the questions, them give the answer, you decide. Sometimes I might come back and make a comment on it, you know. Papa, me need to send the lady with the cancer sinus problem and money, okay? Yeah, Margie. May I tell you, man. Well, guess what, Margie? There's a GoFundMe, you know. There's a GoFundMe. And persons were saying that they're not seeing the branch in the video. But if you look in the description, if you click on the video, you're gonna see in the description, I put the branch is I think the NCB is Oxford Place, and the Scotia is Brownstone. So the account numbers are there. Yeah, man. So bless up on yourself. The news will be coming up at 6:55. Enough respect. Look out for it. A lot of information coming out in the news. All right. Blessed love, everybody.